Hey, this is Doug Field, along with my co-host Ron Bachman and Brent Macy, and welcome back to the final segment of Healthcare Consumers and Radio. And we've got an exciting one coming up because probably one of the most talked about segments in this marketplace, aside from exchanges, is transparency and the emergence of transparency solutions in a lot of different various shapes and sizes. In fact, this week we had 3 interesting transactions take place. Wiser Together getting funded, Healthcare Blue Book getting funded, and HealthSpark making an acquisition. I think we're going to see more of that. Mm-hmm. And joining us as one of the leaders in this space, and but with a very unique position, is Robin Gelburd, President of Fair Health. Robin, good morning.
Good morning.
Hey, good to have you here. And would you give our audience a brief background on Fair Health?
Sure. Fair Health has a very unique place in the industry. We're an independent not-for-profit that was created out of an investigation brought by then Attorney General Cuomo into the insurance industry back in 2009. So we were created to really bring fairness and transparency and integrity to healthcare information in the marketplace, and to bring cost information directly to the doorstep of consumers.
What do you see as some of the most confusing aspects in this category right now? If I'm an employer, I'm getting a lot in the press, I'm getting a lot of people knocking on my door. What's the most confusing aspect to employers and those working with employers right now?
Well, I think what's confusing right now is what types of tools to use and where and what kind of data are you providing to your employees. I think the fact that we're having this conversation now is a healthy one, and it's exciting that the spotlight is on healthcare cost transparency. But there's a lot of experimentation going on, again, which is a good thing, but you really have to really look carefully at the sources of the data that you're providing to your consumers to make sure you're bringing clarity and not just transparency.
Robin, it's Ron Bachman. Did your organization come out of that New York investigation on the usual, reasonable, and customary charges used by the insurance industry and the out-of-network costs? Is that the core?
That's exactly right. And one of the charges in the investigation was that there was an apparent conflict of interest in the data that was being used by employers and their plans to adjudicate the out-of-network claims of consumers. And that's why everyone agreed. It never went to trial because everyone agreed that it was critical that independent, fair, transparent information be used to support those decisions. And that goes back to your earlier question of what employers should look for. They should make sure the sources of these tools are independent, have no apparent conflicts of interest or real conflicts of interest that would really shape the way in which that information is being presented to your employees or your members.
The term transparency, I've always said, is sort of an insider term that the public really doesn't understand. I always prefer to use the term the right to know. We can argue about transparency. Somebody says that's proprietary, it's my own information, I shouldn't have to disclose it. But when you turn it around and say, well, but the public has a right to know, which I think is what your organization is really promoting, they ought to know what the costs are, who's charging them, who's behind setting those rates, so it's not the insurance company setting rates for themselves to be paying out less. Do you agree with that concept? And I have a follow-up question.
Sure, absolutely. It's critical that they have a right to know. In the past, the patient was typically in the background, and the transaction was primarily between the provider and the health plan. But now there's greater cost sharing on the part of the consumer, and the consumer is necessarily a much more visible and proactive participant in the health insurance landscape right now. So not only do they have a right to know about the cost, it's critical that they know to do their own financial planning and to make decisions that are right for them and their family.
So is that right to know? Do you focus on any one particular stakeholder or all of them? For example, the core that we talked about where your organization was founded was on the disclosure of costs that the insurance company is using. Today, one of the big areas that a patient doesn't know about are the costs of the provider services. Is that where you're focusing a lot of attention as well these days?
Well, that's why we have such a unique role in the marketplace. We deal with all of the stakeholders, and we recognize the interdependencies within the healthcare system. Really, it's critical that all stakeholders are involved. It's not a zero-sum game. And so while the initial mandate focused on making sure we were disseminating fair and transparent information to the insurance companies, to service their members. There are obviously necessarily connections between us and the provider community. So we also disseminate data to providers to make sure that they can inform their fee schedules with fair market information. We relate directly to the consumers, obviously, with our educational tools and that cost transparency calculators. And we also work on the macro level with policymakers and researchers because they're really asking the hard questions right now, and we're trying to help them answer those so that everyone can benefit in the healthcare industry.
You know, one of the things that we've seen in the market that is around us here in Georgia, and I think it's happening across the country from reports I've seen, is that with this consolidation of the healthcare industry, the hospitals are buying up physician practices. We're moving towards these accountable care organizations. Bundled pricing is sort of encouraging the combination of the hospitals and doctors where their practices are being sold and doctors are going on salaries for these integrated delivery systems. That recent billings from hospitals for what normally would have been office visits are now being charged as if that office is an outpatient hospital visit. So people are getting bills from hospitals that they never went to just because the hospital is now doing the billing. Are you seeing that, and is that a major concern that consumers ought to be aware of, that they're not paying excessive amounts for what traditionally was a simple office visit?
No, that's a very important question, and that's why the cost transparency is so critical. What we're finding, and in many respects we're like the canary in the coal mine because we interact with so many consumers around the country, there are a lot of issues like that are of concern. For example, similar to that is a consumer who's really done their homework and has gone to what they believe to be an in-network facility, say for their, to have a baby. And so they've chosen that hospital because it's in-network, thinking they're containing their costs that way, and then are surprised to receive the anesthesiologist bill for the epidural because the anesthesiologist is out of network. Again, now that the consumers are being brought much more into the equation and are shouldering more of the costs, they're now taking note of these bills that are coming in, and we're starting to see a much more vibrant discussion about what you've just mentioned and about these surprise balance bills that consumers are being exposed to. And I think we're going to start seeing some changes both, in the market as well as legislatively that are going to help address some of these issues.
Robin, this is Brent. As Ron and Doug kind of mentioned in the opening segment of the program, we're going to actually have a provider group up doing a general session at IHC Forum and Expo in Atlanta just because, they really need to understand their employee or the consumer that's coming in there, their patient, and be able to react to a lot of different questions. How are you helping the providers kind of understand what type of questions they might be fielding from their patient consumer who's coming in a lot more educated in some instances than ever before?
Absolutely, a lot more educated, becoming a lot more confident because consumers are being given information that can help fuel those constructive conversations with their provider. So that's an excellent question. As I mentioned, we serve all stakeholders, so we have a special service, feeestimator.org, that provides practitioners with data to help inform their fee schedules, and as well as providing them with access to our education material, our whole educational platform that it informs them what kinds of questions may be asked by consumers and how to prepare for those questions. We're finding an interesting trend starting that it's almost becoming a market advantage for providers to really be proactive in those transparency conversations with their patients and are starting to advertise more and more what their prices are and are sometimes even advertise that their data conforms to some of the data that we offer to show that they're being very responsible in the development of their fee schedules. So yes, providers are coming into this conversation and they're really trying to arm themselves with information that may be of utility to their patients.
Now, Robin, we got about a minute left on the program, and want to kind of give you the opportunity to kind of give a few takeaways for our audience. What are some of the things that they need to understand about fair health, but also what do they need to understand about this exploding transparency space? If I'm an employer, if I'm a broker, consultant, anyone in the food chain.
As I said, it's just great that you're having programs like this, which really shows how important this has become in the national conversation. And I think that what makes why we're so excited at Fair Health is because we feel this is important on the macro and the micro level. We're trying to help, Aunt Sally navigate her ability to get her hip replacement with information that helps her. At the same time, data is critical to help on that macro level to really affect some systemic change. I think we all recognize as we listen to shows like this and we open the newspaper and travel on the web that we're really in a living laboratory in real time. There's a lot of experimentation going on. It's very exciting for all of us in the healthcare field. We're, thrilled to be a part of this national conversation to share the billions of claims data that we have to help people embark on these constructive conversations with their plans, employers, and their providers.
And Robin, what's the website our audience can find you guys at?
Our corporate website is fairhealth.org, and then our consumer site where we offer our cost calculators is fairhealthconsumer.org, and our provider site is theestimator.org. So we offer, and you can get to all of those through just going to our corporate website, but you can go directly to our consumer website as well, which I might add was honored by the White House at its Summit on Smart Disclosure, which we were very proud of.
Yeah, congratulations.
Congratulations on that, Robin, and thank you so much for joining us on the program today. To our audience, we will, as we mentioned, we'll have the provider general session, which will touch on transparency on the provider side with the patient, and then what employers need to be looking at, and then also for employers, brokers, consultants out there, we do have transparency workshop tracks that you can get more up to speed on the healthcare transparency space. And until next week, this is Brent Macy, Ron Bachman, and Doug Field signing off for Healthcare Consumerism Radio.